O2 produced by electrolysis. Why chlorine is not oxidizing? Antiseptic here. Act on halogen. Which is ganglionic blocker? Hexamethonium. Drug for anaphylaxis. Option A, adrenaline. Profit formula. Option B, selling price minus cost price. Oil soluble antioxidant. Example, sodium sulfide. What drug used in scabies? Permethrin. Option A, permethrin, linodane, benzyl benzoate. Fear of spec management. Explain management. Main function of diluent. Provide bulk. What is Sabin vaccine? Sabin vaccine. Option A, live oral polio vaccine. What is the use of anti-thymocyte globulin? Prevent transplant rejection. FSSAI headquarters is Delhi. Which drug is opioid analgesic? Morphine. Which is the second generation antihistamine? Fexofenadine. China clay is kaolin. EEG measure electroefficiencygram measure brain activity. What is gelatin therapy? Option A, binding of metal for excretion. What is EDTA used for? Lead poisoning. Guar gum obtained from endosperm. What is cellular immunity? Option A, T cell mediated immunity. Monitor sweetness compared to sucrose. 72%. Inferiority means use of substandard drug. Repeatic is a reabsorption of neurotransmitter. Colloidal size range 1 to 5 μm. Effectiveness of preservative depend on pH of formulation. Which drug belong to calcium-C neurin inhibitor? Cyclosporin and tacrolimus. Vacuum dryer is suitable for digital lips. If a patient is confused, pharmacist should option A, use simple language. एवरेज का फॉर्मूला क्या है? सम बाय एन. Cisapride is a 5-HT for agnosis. COVID-19 MERS influenza caused by virus. Option A. WBC involved in allergy. Neutrophil, eosinophil. Liver dose. Option B, detoxification. Easter anesthetic example, tetracycline. Methotrexate act on folic acid antagonist. SOP for medication error, report and prevent error, driest place on earth, Atacama Desert, surface tension is measured by drop weight method, parent region UTR are found in 5 and 3 end of mRNA. Lipid accumulation lead to cirrhosis. Which disease is genetic origin? Muscular dystrophy. Journal is classified as which type of accumulation book? Book of original entry. Option A. Atropine cause mydriasis. Ketamine is a dissociative anesthetic. Task manager is used for managed running process. Sulfonamide inhibit dihydropathate synthesis. How glucocorticoid act on suppress inflammation and immunity. Tagacal is obtained from which plant source? Astragalus conifera. Which method ensure patient undertaking? Take-back method. What is kill vaccine? Inactive kill vaccine, inactivated organism vaccine. What is DNA vaccine? Plasmid DNA inject into cell. Software means hardware program. Schedule P refer to option B life period of drug. SOP required by all of the above. AUC indicate bioavailability. Email used for communication. Profit is equal to sell price minus cost price. Universal donor blood group is O. A. Which general anesthetic has antiemetic property? Propofol. Focus on no property. If patient refuse medicine, explore concern. What is the function of IL-1 inhibitor? Option A block inflammatory response. DNA differs between individual by option B. Option A phase. Option A temperature. What is IL-2 inhibitor example? Option A basiliximab. Liquid paraffin act on stimulate stool softener. Average formula sum by n. Vulcanization increase strength and elasticity. Sodium metaphosphate is used in dentifrices. Which receptor is activated by nitrate? GM, GMP pathway. Propranology, option B, class 2 antiarrhythmic. किडनी फंक्शन, किडनी का फंक्शन क्या है? ब्लड फिल्ट्रेशन, ऑप्शन बी फिल्ट्रेशन. फंजी reproduce by, option B brooding. Antibiotic act on, option B bacteria. Increase of pyruvate and lactase due to deficiency of thiamine. What is penicillamine used for? Copper chelating, option. Best way to ensure adherence, option A address barrier. BCG BCS class 1 permeability. SI फार्मूला, सेलिंग प्राइस का फार्मूला क्या है? PRT बाय 100. लॉस का फार्मूला क्या है? कॉस्ट प्राइस माइनस सेल प्राइस, ऑप्शन बी कॉस्ट प्राइस माइनस सेल प्राइस. Which classes does diltiazepam belong to? Benzodiazepine. PCI is reconstituted after 5 years, option B. Chemotaxis means cell death. Movement of leukocyte. What is anti-epileptic drug? Option A carbamazepine. Mucus secreting cell are goblet cell. What is mycophenolate? Mopetile action. Option A inhibit lymphocyte proliferation. Fat store in, option B adipose tissue. WW stand for option B World Wide Web. Preferred method for drying antibiotic, option A fluid bed dryer. What is humoral immunity? Option A antibody mediated immunity. Increase in surface area affected, evaporation rate how? Increases. HCl in arsenic test is used to make a solution acidic. Unmeliorated nerve fiber are, option A surrounded by a squamous cell but no myelin. Arsenic in sample is initially present as arsenic acid, ciliary body pattern chloride. What, which of the following is not a part of central nervous system? Somatic nerve, option B somatic nerve.